My name is Vicky Irons. I am the Chief Officer of Dundee Health and Social Care Partnership, also known as Integration Authorities. There are 32 of us in terms of integration authorities across Scotland. As of next year, I will have had 30 years experience in health and social care management across Scotland and across the UK. And for those of you who don't know the background, Scotland has seen 3 series of reforms which have tried to integrate health and social care across the spectrum over the years. And I've certainly been in organisations who've gone through those series of reforms. The most recent of which, though, was the introduction of integration authorities in 2015. So I thought I would just spend a minute or two giving you a wee bit of background in terms of what that means for our third sector partnership. As I've mentioned before, we've been through a few series of policy reforms prior to this, and one of the main underpinning drivers for the most recent reforms were to ensure that the full breadth of the partnerships that are spread across our communities became part of the new integration authorities. So when we were formally established, we were required to set up integration joint boards. We were required to put through what's called a scheme of establishment through to Scottish Parliament, which were considered. And we were also required to set up a strategic planning mechanism which involved all of the partners involved in health and social care across the city. So for the third sector, that meant that we have a formal seat on our joint board for both carers and the chief executive who provides leadership across our bodies that, if you like, are the umbrella bodies for the voluntary sector. We have DVVA, which is the umbrella organisation, and the chief executive of that sits on our board. And in addition to that, in terms of carer input, we also have quite significant networks of people that use all of our services, and they have an equal seat, if you like, in terms of the membership of our planning forums. But that's not to say that there wasn't any level of input prior to the introduction of the IGBs. It's been very present in terms of the culture within Scotland for many, many decades. So that's a wee bit about health and social care integration. It was described early on as a movement of partnership rather than just an organisational reform of the public bodies which are established in Scotland, which include local authorities who oversee all of social care, and our NHS boards who provide all of our national health services. The idea behind the health and social care partnerships was to make sure that there was equity of relationships, but also equity of input and experience into our decision-making processes. And I have to say, from my own perspective, they've been one of the deciding factors which has enabled us to flourish and become the organisations that we have. So just one more thing on this slide in terms of my own overview of the importance and the pivotal role the third sector plays, particularly in the provision of health and social care across the city and Dundee. And that's really about the challenge ahead. I'm sure these challenges are probably felt by most people in health and social care systems, but certainly within the last year, we have witnessed an unprecedented change in demand for our services. We have seen a 20% increase in the level of care which we provide in people's own homes. But actually, we also have data which records what we call our unmet need. And that's currently showing that we have 4 times the level of demand than the supply that we have for providing care in people's own homes, which is of considerable concern. And inevitably, that burden of care falls on particularly carers and family members and unpaid carers to provide that level of input to be able to maintain people in their own homes and their own communities. In addition to that, a phenomenon that we've seen across our acute sector, particularly in recent months, is what we describe as our take, particularly through emergency care. We've seen a 25% increase in the number of admissions to acute care. There's thinking behind that a lot of that might be deferred demand as a result of the pandemic, And certainly we've had to reduce a lot of our elective activity throughout that period, which has translated into many more people presenting in our system as emergency cases, but also with much more complex needs. And our frailty indicators are showing that the needs of our population are changing way beyond any of the predictions we had that were aligned to demographic change. So I guess within that, what I'm trying to say is there is no way on earth that the public sector funded authorities have got the capacity to respond to that level of demand. Even if I was to employ every school leaver in Dundee City within the next 5 years, it wouldn't provide the level of workforce that we require to be able to respond to that level of need. So we have to build what we describe as the capacity to care across our third sector partners and across the city. So before I joined you this evening, I asked my leadership team if they could give me a few examples that they would be happy for me to share with you. And I have to say, I said in the run up to this evening's opening, I was inundated with examples, which is a really, really fantastic, I think, reflection of the activity which is underway. Many of the developments we've seen in Dundee City actually are award-winning. It doesn't harm to be the best is my motto when it comes to developing new initiatives. But so some of the examples I share with you tonight have been recognised both through Scottish Government and COSLA, which is our organisation which overarches our local authorities as well. But there are many, many more behind these slides, and I'd be more than happy to share those with the network if it was felt to be useful. So the first example tonight is an award winner in terms of Partnership in Action. And we were the runners-up in the Voluntary Sector Partnership Award, which was hosted at Scottish Parliament very recently, and a fantastic evening. And that's about what we describe as Dundee Safe Zone. Dundee Safe Zone was initially launched in 2019, but actually came into its own during the pandemic, and essentially provides care and support and a cup of tea and something to eat in all of our neighbourhoods across the city, and particularly during the pandemic when people were required to stay at home. This was the only presence in some people's communities that was there. It's open to everybody, and anybody can come just to have a chat, to get a warm cup of tea or coffee, but also to get the support of our voluntary sector and some of our partners in the statutory sector as well. And this is just the worst possible description of a service in terms of the letters you see at the top of this slide, but hopefully the slide itself gives you an overview of the work we do around drug and alcohol use as well. But we also launched in 2019. Many of these were launched just before the pandemic, which again really came into its own, the Dundee Non-Fatal Overdose Rapid Response Team. And rather than read out the slide, I'll just give you a reflection of that. But essentially, we have a completely integrated response team now, which provides support for individuals who've experienced a non-fatal overdose. And the aim of that is to try and reduce rather an unwelcome record that we have in Dundee as having significant amounts of drug-related deaths, but to ensure that people and their families have the opportunity to engage with the voluntary sector and with our public sector, and to ensure that they get the treatment and care services that they need, and most importantly, to prevent future incidents of drug overdoses. This has been developed more recently to be trauma-informed as well, in terms of us understanding the underlying issues which can often contribute to a non-fatal overdose. And one of the other examples I wanted to give you, and this is probably the worst slide in history in terms of its lack of focus, but there's a link on here in terms of the web link, was developed with Dundee Voluntary Action, and that is essentially to make sure that we have a response available across the city which responds to lots of the social isolation and the loneliness that was mentioned earlier on in the workshop today. And this was developed by a leader within Dundee Voluntary Action, and it essentially is a portal that's web-based, which provides links as a one-stop shop to all of the different community groups, all of the formal support mechanisms that we have in, and every other item that's available to people, particularly initially targeted at the frail elderly across the city, but we've now extended it because we've had so many people contributing to this one-stop shop approach so that it covers all adults. It's not a resource which is targeted at younger people and children at the moment, but where we have that under development as well. So just some great initiatives. And essentially this was described to us at our strategic planning board as the front door. And I think that's one of the most important things that I would like to leave with you today. And that's that this has completely opened up access to the right care and support that people require. And it's definitely not based on an overly medicalized model, but it's essentially what people need.